Okay, y'all, I'm about to tell you the secret about these PAPs. This is the part that nobody wants to talk about, but I'm about to let y'all in. Come on. So, first things first, what is a PAP? Close this door because they can't know I'm telling you this. They can't know. So this is a PAP test. I mean, it's a specific brand, but it is a PAP vial. Used to be a PAP smear, which we would put on a slide, but now we put the cells in that vial. And then there are various brushes, okay? So assuming that we use the broom, this is how a PAP is done. Imagine this is your uterus and this is your cervix. This is an IUD thing. You carefully insert the speculum and you put the brush here and you take a sample right here of the cervix. And the PAP is screening for cervical cancer or precancer, right? So that's why we do a PAP, is to screen for cervical cancer or precancer. But let me just tell y'all the secret. I gotta sit down for this one. The secret is that PAP screening guidelines are just guidelines. Let me back up. Why did the guidelines change? The guidelines changed back in 2009, and then they were reaffirmed in 2013 that we don't need yearly PAPs. So it's been over a decade that we have reaffirmed these guidelines. And why did they change them? It's because we learned a lot about cervical cancer. Cervical cancer is a slow moving cancer, a slow growing cancer, a cancer that doesn't go from nothing to cancer in a year. It goes from nothing to cancer in multiple years. Like some even would say close to a decade it would take for a person to go from normal cells to cervical cancer, okay? And so because of that, we don't have to look as frequently anymore at the cells. Add to that HPV testing. HPV is human papillomavirus. Human papillomavirus is the reason why cells become abnormal. It is the cause. It's the causative agent as to why cells become abnormal. And so if we can detect HPV, then we can know if a person is even at risk for cervical cancer. If you don't have HPV, the likelihood is you're not going to have cellular precancer or cancer. So now we can say in younger people under age 30, if we look at the cervical cells every 3 years, we can detect anything before it becomes dangerous. For people who are over 30, if we can look for abnormal cervical cells and HPV every 5 years, and if we know that HPV is not there, then we can also know that they're safe and out of harm's way, okay? So again, it's because we know that these things don't happen as often. Like if somebody says to you, I need a colonoscopy, I got a colonoscopy, and now I don't need a colonoscopy, the colon cancer screening, for 10 years because my colonoscopy was normal. Well, would you then say, well, I need a colonoscopy in a year? Well, no, because I know that if you don't have any polyps and you don't have any signs of precancer, you don't need a colonoscopy for 10 years. If you do have polyps, you may need a colonoscopy in 3 years or 5 years. And so the same thing is true for PAPs and for abnormal PAPs and colposcopies. Colposcopy is an evaluation of the cervical cells. And so we're getting ahead of ourselves, but the point is that we learned that PAPs don't need to be done as frequently because cervical precancer and cancer occurs really, really slowly. Now, here's the secret. These are just guidelines. These are just guidelines. If you want a PAP every year, I'm gonna do it. If you want a PAP every year, I'm gonna do it, because why not? There are some pathologists that say we should never have changed the guidelines because some of these precancers and cancers actually occur really aggressively, and they can move quicker than the general population. If you look at the studies, most cervical precancer and cancer are going to move really slowly and develop really slowly, but there are going to be some that are really aggressive and that are going to come for you quick. And so some pathologists say, no, check every year. And some people, for peace of mind, because they grew up in a time where PAPs were done every year, they say, check me every year. I'm going to check every year if that's what the patient wants. Because why not? Because guess what? Insurance going to cover that bad boy every year. Insurance will cover it every year. Now, they may not cover it more than once a year. Don't be out here trying to get a PAP every 6 months. But if you want to get a PAP in a year, insurance will likely cover it. And it's no skin off my back. Why not? Like, check it. Peace of mind, check it. That's the secret. The secret is if you want a PAP, you can get a PAP. Now, do you need a PAP? No, you may not need a PAP, especially if your PAP has been normal and your cells have been normal. You can rest assured that the cells on the cervix are not going to just up and try to come get you, like out of nowhere. most people can rest assured about that. But those who either just feel the peace of mind of wanting to get this done every year, or maybe know somebody who was affected, or are worried that they could have one of those aggressive strains I mentioned, go and get your PAP. That's it.